here to discuss the important aspects of what is called as a collapse of kitchen culture in urban India. Today what is happening is most of the households or people are not enjoying cooking nor enjoying eating. So what exactly I mean by this collapse of kitchen culture? This is the hashtag, what is the real hashtag word now today, is that collapse of kitchen culture. Why is this kitchen culture has collapsed? Why people are not enjoying eating, enjoying cooking? Why there's a dominance of Swiggy, Zomato? Everyone, it's in the touch of button. Even food has become online. So what is this ill effects or bad effects of this collapse of kitchen culture in India? If you look at the whole traditional habits of cooking, most of the time we used to notice that we used to have a very good mixture of high protein and high fiber and less carbs. So the ingredients also used to be managed in such a way that you have a high protein, we have fiber, less carbs, and the minerals and micronutrients were mixed. For example, have a simple food, a simple ragi ball, a very good dal, or what is called as millets or cereals, followed by very good green leafy vegetables. These are the things which used to give us a complex carbohydrate, a protein, a fiber, and it was a mixture. That was called as what is called as a mixed act diet. Today what is happening is slowly the carbohydrates has taken over the diet. To make it more faster, we add chemical and make it more tasty. And there are some chemicals which are more of taste makers, additive forms, and we get addicted to that sort of food. That's what I call it as the Swiggy or Zomato cultures. So to break this culture, you need to have what is called as the kitchen, which should be having that sort of ingredient, which should be a very mix of high protein, fiber, and less of carbs and micronutrients. For example, today in urban India, we have seen a lot of people using their phone apps for ordering a lot of food. Yeah, that's the culture we have developed. If you look at any of the Indian cities today, they are ordering so much of food, and which is more of less nutritive, more of taste maker, more of chemical based, and at the end of the day it is not giving nutrition. This is what I mean by deficit nutrition. Deficit nutrition is the first and foremost cause of developing lifestyle disease. So all of us, we need to be clear and be thinking around what exactly we need to do to reignite the concept of a very good culturogenic food habits India used to have in 40 or 30 years back. Before the urbanization, India used to have a very good the kitchen culture. What it means to say, it was a mixed diet. Today it's still mixed diet is one thing which is going to help you out in protecting the nutritional aspects of the body. I don't think so. The outside food, what we can do it is, for example, if I want to always quote an example when I meet my patients. If you want to take a pizza in any of the brands which are available in the market, it takes a minimum of 400 to 500 rupees, including the GST. But when you make the same pizza at home, the cost comes down by less than 50 rupees per pizza. Why is it so? Because in homemade pizzas, it's not that pizzas are wrong. To be honest with you, all pizzas are not wrong, and it's not called as junk, to be honest with you. So what we need to do is, we need to encourage the food habits like doing a pizza at home. What are the advantages of doing a pizza at home? You can choose your vegetable, you can choose your micronutrient, you can choose your which sauce you can use, and most of the time you can avoid the chemical based sausage, which most of the time sauce we use, which are this one, and it is more nutritious, and the same taste can be brought on if you try to adapt the same habits what they use. So the excessive usage of that sort of cheese that sort of chemical waste can be controlled. So this is what I really mean by a collapse of kitchen culture in India, and we need to reignite what is called as people should start enjoying cooking and people should enjoy eating.